I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Good morning, I'm Suzanne Upward, a registered nurse and your host today of Boomer Health at Home. First aid is an important consideration when caring for elderly. And today we have Dr. Stephen Johnson, a longtime emergency room physician, as our guest, and he is here to share with us some tips on first aid in home and some common injuries that you see in the ER as we age. So welcome.
Thank you.
And could you tell us a little bit about who you are, your background, your experience?
Well, I've been an emergency room physician for over 30 years, mostly in smaller ERs where you're the only doc there.
Wow.
And I went to undergrad, University of Michigan.
Go Blue.
Go Blue. And a medical school in Kansas City. I did a general rotating internship and then went into emergency medicine.
What made you decide to go into ER medicine? Because as we had conversation earlier, it takes a special person to work in the ER.
Well, the nice thing about emergency medicine is when you leave, you're done. There's no call. There's nobody calls you back. So there is that. It's pretty intense where you're there sometimes, but when you walk out the door, you walk out the door.
You're done, and then you can go have family time, correct?
Exactly.
So, as an emergency room physician, you have seen your share of seniors coming in, especially in rural hospitals where you've worked. What are the most common injuries you see of a senior coming in? And a senior nowadays is 50 on up. So. Yeah. What do you see?
Falls by far, and as we age, our reflexes, aren't as quick as they once were.
Our balance is off. Yeah.
And we don't heal as well as we once did.
That's true.
So when a senior falls, there's always potential for more damage than if
what we call comorbidities, if they've got some breathing issues or cardiac issues on top of that. Good. Some of the common things, though, are cuts and scrapes at home, correct?
Yes.
So how would you tell someone to treat that at home? Would you say come into the emergency room if it's A, B, and C, or fix it or care for it at home if it's CDE? What would you say?
Well, if it's a minor injury and it's bleeding, pressure almost always works. That's exactly what we're going to do in the ER when you get there. If there's bright red spurting blood and obvious arterial bleed, that you want to go to the emergency room for.
Right. Call 911.
Call 911. It's there at your beck and call.
That's right.
There's no reason to go to the ER and wait. The advantage of an ambulance is you go to the front of the line. At least you get right in the ER.
And you have medical personnel on the spot. So it's not me driving my 90-year-old mother to the emergency room. You told a story earlier about your father-in-law, I believe, how he banged his head on a cabinet and everyone was freaking out because he was bleeding. And how did you treat it?
Well, we cleaned it up, put some pressure on it, and got the bleeding stopped, and applied a little super glue.
And he was good to go.
He was good to go. No scarring, nothing.
Miracle. I wouldn't recommend that at home. Would you?
Yes.
You would? Okay.
It depends on the injury, though.
That's true.
If you think, boy, maybe I could treat this with super glue, you probably can't. If you think, I probably can't, trust your intuition.
I remember that. I have 13 grandchildren. They're always falling and scraping. And because I was an emergency room nurse, I don't get too excited. And you don't get too excited about things either. I'm kind of like, if it's not gushing blood, we can
Right.
fix it. If it's gushing blood, okay, then we're gonna act on it.
Well, I can tell you how I feel about super glue. My oldest son is 34, and he's never had a stitch in his life.
Because you've super glued him?
He's been super glued his entire life.
And he's survived, and he's scarless, correct?
He's scarless, yes.
All right, that's funny.
But you have to get the bleeding stopped.
Right.
If you can't get the bleeding stopped, you
Right.
should go ahead.
And then how do you keep it sterile? What would you recommend in the home?
Just a mild soapy solution.
Right.
Rinse it well.
Right.
If you want a little
Pat it dry.
pat it dry, a little peroxide if you want or something.
Right.
But
Maybe a little Neosporin or
for dressing,
AAA.
yeah.
Good. Okay.
I think sometimes people heal better without a Band-Aid or dressing.
I agree. Air to dry it.
We have millions of years of evolution. We healed without bandages just fine.
And documentation to support it. So
Yes.
yeah, you're right. You're right. So different parts of the body are more problematic than others. Some areas bleed more than others. I scraped my knuckle, barely any bleeding. I scraped my arm, and it was dripping down my arm. So why is that? Is it the venous, or why is that?
Well, just normal breakdown of, we're not, our skin isn't as healthy as it were young.
Yeah.
And
That's true. It's thinner.
you lose elastin, which gives it stretch. So when blood supply is probably a little bit compromised, so it's going to take longer to heal. It's going to bleed more when you do cut yourself.
Okay.
It's
All right, well, that's interesting to know. So let's talk about some burns and scalding. We all at times burn themselves. I pulled out was roasting a chicken, and I pulled out a chicken of the oven recently and burnt the whole side of my arm. What do you recommend?
hurts, doesn't it?
Yeah, it hurt like heck. It blistered. Yeah, it did.
Well, for burns, first of all, if it goes all the way around your arm or your leg, okay, circumferential width, then that should be seen by a burn.
Right. That's a 911 call.
Yeah.
Right.
And then lots of fluids.
Right.
Burns tend, especially if you have blisters that break, should never break the blisters. Just
Right.
put a soft.
That's a
dressing on them.
fallacy. People used to break a blister, right? That's a leading cause of infection. Excellent.
Because that skin still provides a barrier, even if there's a blister.
That's right.
there.
And the body absorbs the fluid from the blister. Right.
It takes a lot longer to heal if you.
Yeah, it does. So like you said, if it's a say that word again.
Circumferential.
Thank you, circumferential.
How often do you get to say circumferential, huh?
Yeah. If it's that kind of burn, then definitely we want to seek medical attention. If it's just a burn like I shared with you that I had, you want to clean it. Make sure that there's no sign of infection on it. Wrap it if it's going to be rubbing against a cuff or anything like that. Good. And the same with sunburns. I mean, we get sunburns, and we should do something similar.
The best thing for sunburn is to avoid it.
Right. Wear sunscreen.
And seniors should wear sunblock when they're, when they're outside.
Yeah, especially us fair-skinned people.
As far as like other burns, if they're very young or very old, under a year, should always go to the emergency room.
Good point.
Elderly, use your judgment. If you have a fever, and then, like we said, if there's a lot of ruptured blisters, you need fluids.
Definitely. We also have insect bites and stings. The spring is here finally, and so the bees are out and the spiders are out. And what do you recommend with that?
If you look at an active ingredient, any over-the-counter anti-itch spray, it's alcohol.
Calamine lotion, would that help?
Good, but
that old
for the itch initially, hand sanitizer. It's like 70% alcohol, so you've got. It's way
interesting.
cheaper
I never
than buying,
the Benadryl
ones.
cream.
Yeah.
I didn't know that.
Benadryl for the itch, maybe a little topical hydrocortisone over the counter.
Okay. And you should seek medical attention when you see an infection brewing from it, because we do have brown spiders, I think they are, that can create.
They're pretty rare in Michigan.
Are they? Okay.
But they're pretty nasty when you do see them.
Yeah, they are. They absolutely are. Let's talk about nosebleeds. So we know that seniors get nosebleeds for a variety of reasons: blood pressure issues, dry nasal cavity. How do you tell someone in the home that suddenly they have a bloody nose? What do you tell them to do?
Lean forward. You don't want to swallow it.
Right.
And
so we don't lean back like we were taught years ago.
Pressure your bridge of your nose.
The bridge of your nose.
Keep it on there. Maybe an ice pack to decrease the amount of blood going to it.
Okay. And if it continues after 15, 20 minutes, a half hour, seek medical attention? Is that about good?
Mm-hmm.
Okay,
yes.
Excellent. Okay. So The leading cause of death we know in seniors is falls. So we're going to talk about fractures. You mentioned it earlier that that's the most common thing you see in the emergency room is fractures. What's the most common fracture you see?
Actually, well, maybe it's just because they're more spectacular, but when an elderly person face plants, the reflexes aren't there, they can't get their hands out, and you see it pretty regularly. It's just flat, full weight right on your face and nose.
And then they have facial fractures.
And you get the, black eyes and the swollen face and everything like that. But when a senior falls, the first thing you do is assess. You don't run over and try to get them up.
That's right.
Do a kind of a general survey, ask them what hurts, and if they're not moving, maybe even undress them a little bit.
And loosen their shirt.
Yes.
But don't turn them. Being a former...
Not till you assess their injury.
That's right. That's right. That's right. So that would be one of the first aid actions you would do, is just to assess the situation. Make sure that they're breathing, correct? If they're not, access 911. And quite frankly, I would, with a senior, access 911 right away, because you don't know what's going on.
Before any of that, get yourself the medical alert. Those things are worth their weight in gold.
That's true.
My mother-in-law, the EMS people knew her by her first name. They had a key to her house. So. But
well, that's okay, but they were there and they helped her, and that's what they're there for. You pay a monthly fee for it.
Exactly.
I'm not there yet, but I'm sure I'll get there someday, God willing.
So.
and my children live out of the area, and I don't want to be a bother to them. So, my plan is to invest in one of those.
Why don't you want to be a bother to them?
Because
they were a bother to you once upon a time, right? So.
Well, some days, but I always want to worry about them. I don't want them worrying about me. Let's talk about hip fractures, some of the signs and symptoms of hip fractures, because that is a very common fracture. President Carter fell the other day. He was getting ready to go turkey hunting at 94 and fell in his home and broke his hip. And one of the things they said as he first came out of surgery is, can I go turkey hunting, because season's going to be over in a couple days. So God love him, right?
Well, what frequently happens there isn't they fall and break their hip, is their hip breaks and they fall. Just from wear and tear, and your bones get thinner, and you never know what came first.
That's true. Good point. Good point. What would be a sign and symptom of a hip fracture? Besides the obvious displacement, you can see the displacement.
Maybe shortening of your leg a little bit if it was all the way off.
Okay.
Tuberosity was totally disconnected. But pain, decreased range of motion. They don't want to move it.
Right.
Although I've seen some elderly people with some fairly serious hip fractures that walked into the air. So.
Were they women? They were tough?
Yeah, of course they were.
They were tough?
Well, in the air, we say that a man's 8 is a woman's 2.
I have to agree with you. I have to agree with you on that.
Yeah, call her if you got complaints, not me.
Exactly. One of the other things I remember in the emergency room, when I would have patients come in with a suspected hip fracture, they're in so much pain that their confusion accelerates. If they've had any confusion at all, and as we age, we do get confused. We forget an appointment, we forget we've sent an email, we forgot we read an email, whatnot.
Why we went to the fridge.
Right, or why did I go in this room? And then you're like, good Lord, is this the first sign? Yeah, so you understand. So I remember when, as a young nurse, seeing that, and it frightened me, because oh, what's going on here? But that's a typical classic sign, isn't it? That the pain is just, they almost lose their mind from the pain. Now,
especially when they try to move it.
Right.
It might be, tolerable at rest, but if they even a little bit of any kind of motion at all.
And so one of the recommendations I would think you would recommend is, if a family member thinks mom has fallen and broken a hip, is don't move them.
Exactly.
Call 911. Assess them, make sure they're breathing, that they've got an open airway, that you can make some conversation with them, but call 911 because you don't want any further injuries. It could be a pelvic fracture, it could be a lumbar fracture.
And EMS knows how to lift them.
That's right.
You probably can't lift them yourself.
No, because they're dead weight at that point. And I like to think I'm pretty strong. You're right. Let's talk about heart attacks and strokes. What are the signs of someone experiencing a heart attack?
Well, chest pain is a classic sign, obviously.
Radiating down the left arm?
Sometimes into the jaw or left arm. If they've got chest pain and their diaphragm are sweaty and short of breath, that's
classic.
Not a good prognosis.
Now, is there different symptoms or signs and symptoms for me as a female and you as a male?
Just they're a lot more frequent in premenopausal women. I don't think heart disease isn't even in the top 10 causes of death, but as soon as women become postmenopausal, it's at 1 out of 4.
Yeah. Oh.
So it's just a lot more likely.
So I need to keep running to keep my cardiac health, right?
Exactly.
There, very good. What other, what first aid should be considered when you think there's a heart attack?
Well, ABCs, check their airways and breathing, cardiac status.
Right. 911.
Oh, absolutely.
I can't tell you how many people, wives drove their husbands in and they were having a major heart attack sitting next to them, and for whatever reason the husband doesn't want the ambulance called, or a lot of times people worry about the cost. I mean, retirees, most retirees are on fixed income, so they think about the cost, or they think I'm just going to drive them to the hospital and everything would be.
Or let alone a helicopter ride, maybe, they have an obvious acute MI.
Well, right, and when you're at a rural hospital, you might not be able to provide the cath lab, right?
And I've had them refuse transport by air.
Are you serious? That's interesting. Well,
usually the wife steps in and says, no, he's
out of it, and I'm overpowering. We're going to consider him not of sound mind, and I'm going to become his advocate. I get it. What are the typical signs of a stroke?
Loss of function, whatever part of your brain. There's two types of stroke. There's hemorrhagic and occlusive. Okay,
tell me about the hemorrhagic.
Hemorrhagic is a bleeding stroke.
Okay.
And those are more immediate. Obviously, it needs to be evacuated, so you need to get to not only a hospital, but a hospital with a neurosurgery, neurosurgical capability.
Okay.
But loss of function, tingling, numbness, speech. There's all kinds of symptoms.
There's lopsided.
Lopsided. They want to say something, but
the words don't come
out. The words are in their head, but they can't get them out there. It's usually pretty obvious when something's going on. It's important because the window for stroke, for giving lytics to dissolve the clot is
about this big, right?
Yeah, it's really short.
Yeah.
And then if you're not sure that it's happening, well, let's wait an hour. Well, it's getting a little better if you had a TIA or something, and
you've lost an hour.
Yeah.
Oh my gosh, which causes damage. And what was the other kind of stroke?
Occlusive. A blood clot, where you just get a blockage of blood flow to the brain.
Okay.
And that's where the TIAs, or mini strokes come in, where you get a little tiny clot.
Is that like a precursor to the big one?
Usually, yeah.
Usually? Okay. Okay, and so they would still treat it with anticoags?
Not for a TIA, no. That would resolve by itself.
But I mean the occlusive, if it
yes, if it's in the time frame and other criteria are met.
Okay. All right. So what first aid would you give a patient at home, a stroke victim at home?
Well, call 911.
Right.
ABC, and a supportive care. Maybe give them an aspirin.
Right. Oh, that's a good sign. And same with a heart attack, a suspected heart attack, is to give them a baby aspirin. If it happens
in public, you should always ask, does anybody have any nitro?
Really?
Lots of our patients well, but
Okay, that's interesting. I didn't realize that. That goes hand in hand with a lifeline too, because we have so many seniors living alone that if they think they're having that sign, they should use that life alert. Err on the side of something's going on versus it's going to pass.
I don't know why anybody wouldn't want to have one unless they're just sick of living,
Yeah, I guess. Well, I think
and that happens,
It does, but I think it's also a dignity thing. We're getting older, and like I shared with you a few minutes ago, I don't want to be a burden to my children. I can handle it, and so I see that regularly in the work I do.
How much of a burden are they going to be if you're dead and they have to plan a funeral?
Well, I know, but hopefully you've got everything taken care of in that situation. Obviously.
I mean, maybe you wouldn't be amazed, but there's a lot of people out there that don't have any planning whatsoever.
I know. No, I'm not amazed.
Even to an advance directive. I mean,
right. And that should all be part of this whole first aid kit that you have in home. I was going to ask you next, what would you suggest to have in a first aid kit? But one of the things I would really recommend is have that power of attorney, medical attorney, as part of your first aid kit, because when you have to call 911 and they say I'm no longer a full code, I want that paperwork there, so that when EMS comes in, they don't start pounding on my chest and doing CPR and I have a tube down my throat, and that's not what I wanted. So let's talk about a little bit about a well-stocked first aid kit. Besides that those legal documents?
Some Hemocleanse, some mild, topical cleanser.
Okay. What did they used to have that was in a green bottle? It wasn't Hemocleanse.
Betadine.
Was it Betadine? Yeah. Do they still use that?
Yeah, I like Betadine.
Do you? Okay.
Just alcohol, Hemocleanse, Betadine,
Okay.
just irrigation with sterile saline. There's
Okay.
a number of things you can do.
Okay, and then obviously your basic Band-Aids and maybe some bacitracin, even though we
Yes.
talked earlier about the importance of just soap and water.
What's a Coban? Should I have some Coban?
Oh, okay.
Which is just like an ACE wrap
That's
that
right.
sticks to
And
itself.
and it'll apply pressure if
So you
there's a
don't,
bleeding.
and elderly people don't want to have tape on their skin.
No, because it tears, skin
It does.
tears. I know. I'm getting thin skin too because I'm getting older, unfortunately. Yeah, I totally understand that. And also, one of the things I would really recommend is that they check the expiration dates on all those things. Because I moved, my husband and I moved at Christmas time, and I like to think that I'm up on that. I had so much expired Tylenol, Excedrin, bacitracin. I'm like, God.
10, 15 years old.
Well, not quite that old. It wasn't quite that old. It was a couple of years old.
We cleaned out our stuff. We had stuff there, but it was only antibiotic samples from when my kids were little.
I know. I think they're expired. I don't think they're any good. I found some remember mercurochrome?
Oh, yeah.
I found a little bottle of my husband's. I swear to God, he had it as a child. I'm like, honey, this has to go, and he still kept it. He's like, no, it's still good.
Mercurochrome and methylate.
Methylate. That stung.
And man, they stung.
They did. And what was the purpose of that? Was it just an antiseptic, basically?
Yeah, it's an antiseptic, and I think the thought behind it was if it stings that bad, it's got to be doing some good.
Yeah, and then you stick it back in the bottle, and you've reinfected the bottle. I never understood.
I don't think too much can live in that bottle.
No, I don't think so either. It's probably still good stuff. Well, I want to thank you for coming in. I think our conversation was pretty informative. We covered a lot of topics about seniors and things that you see in the ER, but also about people, just people in general. I hope the conversation we had may save a life. Maybe someone will hear it and say, oh my gosh, I'm having some cardiac symptoms.
Maybe they'll call 911.
Maybe they'll call 911. Or better yet, invest in a life alert.
Exactly.
Or even better, develop a plan. So that, as you said, when they're planning a funeral, that's all written out because they chose not to call 911. You have been watching Boomer Health at Home. Thank you so much, and thank you, Dr. Johnson.
Thank you. Appreciate it.